Good evening. My name is Olivia, and I am the Communications Director for Congresswoman Lois Frankel. Thank you for joining our interactive Access Live telephone town hall event. This event will give you the opportunity to speak directly with Congresswoman Frankel and a panel of guests. As I mentioned, this is an interactive forum. If you would like to ask the Congresswoman and guest speakers a question, you can press *3 on your phone keypad at any time, and you will be placed in line. Again, that's *3. An operator will take down your name and a brief summary of your question. If your question is selected, I will read your name and question for the Congresswoman and our expert. If you are participating online, you can submit your question below the streaming player. If we do not get to your question, please stay on the line, and at the end of the call, you will be able to leave a voicemail with your question. We will get back to you within a few days. Again, if you have any questions throughout the event, please press *3 on your keypad. That's *3. Now, I'd like to turn it over to Congresswoman Frankel.
Thank you, Olivia. Hello, everyone. This is Lois Frankel, your member of Congress. I want to thank you all for joining me tonight for this telephone town conference, this call on coronavirus. We expect thousands of our constituents to be tuning in tonight. And I hope that with tonight's call, we will help direct you to the resources you will need to navigate this pandemic. So let me start by saying, the statistics are staggering. I'm not going to get into them. The numbers of coronavirus cases are rising rapidly in our country and in our state. We know there's no vaccines or cures. That's the bad news. The good news is that you are the best defense against this virus. So I want to just repeat the advice that we keep hearing from Centers of Disease Control, that we should all be following the following: practice social distancing, wash your hands frequently, don't touch your face, and disinfect your surfaces that you go near thoroughly. Just to let you know, I'm following this guidance as well, which is why we're hosting this town hall over the phone. And I have a very knowledgeable panel that includes State Senator Lori Berman, the Director of Palm Beach County Health Department, Dr. Alina Alonso, Todd Valerian, the Assistant Palm Beach Administrator, Palm Beach County Administrator, and I think also we got Virginia Baker, who is our Administrator of Palm Beach County. We got Dr. Brent Schillinger. He is the Palm Beach County Medical Society, a former president and a very reputable physician. We'll have Victoria Guerrero, a South Florida District Director of the Small Business Administration, and Sharon LaRue, President and CEO of 211 Helpline, Palm Beach County. And then also, thank you for joining us again, Karen Brill, a member of the school board. So you know that all the panelists are joining me tonight from separate locations to answer your questions. So here's what you can expect on this call. First, I'm going to outline some of the congressional actions, and then our panel will take your questions on health, employment, on what's going on with the schools, on social issues. And we'll probably repeat this a couple of times, but a lot of this information you're going to be able to get on my website, frankel.house.gov. That's frankel.house.gov. So we all know that the pandemic is having so many effects on our health, on our financial resources, and our sanity. So here's what Congress is focused on: saving lives, supporting families, workers, and small businesses. The House is expected to pass either tomorrow or Saturday I got somebody calling me on another line here. The House is going to pass tomorrow or Saturday our third very, very big legislative package, probably the biggest ever in the history of our country. We're going to make large investments in hospitals and health systems. We're going to increase federal unemployment insurance benefits by $600. That's on top of the state unemployment insurance benefits. and that'll include everyone. That means even independent contractors will be able to apply. We're going to provide $1,200 of immediate cash assistance to individuals with income up to $75,000, plus $500 per child, and that's also for not only for workers, but that's also for Social Security recipients. We're going to have expanded relief for our small businesses through SBA loan forgiveness and grants to keep businesses afloat. And this bill that we're going to pass either Friday or Saturday is in addition to two bills we've just passed, which we put a lot of more money into the health system. We have emergency paid and sick leave for employees and caring for sick members stricken with coronavirus, or caring for a child whose school has closed. So that's some of the very positive things that we have done in Congress. I do want to mention some of the glaring issues that we're dealing with here locally. First of all, we need more testing. It's not the fault of our health department or our doctors or our hospitals. We just haven't been getting the testing swabs that we need, the supply. We don't have enough testing sites. I was on a conference call today with FEMA and with the state emergency management folks, and they have promised to work with the county on a testing site, and I know Virginia and Todd, maybe you can comment on that later. We also are in dire need of more personal protective gear for our first responders and for our medical people. Again, on this conference call, we were promised that more would be sent our way. And the other sort of glaring obstacle right now is, although we have really good increased benefits for people who are out of work, the Florida unemployment website is a mess right now, and I could just, it's very difficult navigating it. So be patient, because when you do navigate it, the benefits are going to be there for you. Just to let you know, our legislative delegation has been working really around the clock to try to get improvements in all these areas, in testing, on the personal protective gear, and trying to fix the process for filing unemployment. And so has our county. I want to thank Virginia Baker for your fantastic leadership on that. And then the last thing that I want to mention on is the importance of sheltering and people taking their own responsibility, not only social distancing, but shelter in place if you can. Many of the members of our congressional delegation has asked the governor to issue that order. He has not done that yet, and we just think it's better to be safe than sorry. We see the numbers all over the world and in this country, and we think the best way to stop it right now is for people to just stay in place. So with that said, I think we're ready to take the questions. Now, here's what we're going to do tonight. We're going to try to do rapid response so we can get to as many questions as possible. So I'm going to ask our panelists, you're going to use your best wits to keep the answers brief. And again, a lot of these resources that we're going to talk about tonight, you can find on my website, frankel.house.gov. That's frankel.house.gov, as well as many other websites that our panelists are associated with. All right, so let's go, Olivia. Let's get the questions.
Thank you, Congresswoman. And if you're just joining us now, welcome. And don't forget to press *3 on your keypad for the chance to talk directly with Congresswoman Frankel and our guest experts. So we're going to kick off tonight's call with a question from online, from Lisa. Why does it seem like all businesses except hospitality are considered essential businesses?
Congresswoman, this is Todd Von Laren, Assistant County Administrator. I'll take that question. First off, thank you, Congresswoman, for your leadership in working with the Congress and our colleagues and with us through this very difficult time. We really appreciate it. To the question specifically, Palm Beach County has put an order 2 out that is very similar to Broward's and Dade's that they had done previously in terms of some of the businesses that we've deemed to be critical during this period to remain open. I want to make clear, though, our mayor yesterday followed suit and said to the residents of our county, for those individuals that are over 65 years or older, for those that are experiencing respiratory issues and other ailments that could help further problems if they contact COVID-19, to stay home and urge them to do so. And we continue to do that. And we want people to do what they can to socially distance from one another. But the businesses that we've left in place are ones that we think are critical to serving individuals in this community during this ordeal. Food service organizations, healthcare organizations and assisted living facilities, as well as a number of different businesses that help support individuals from a banking perspective and from a transportation perspective for those that need to get the necessities to get back home. So there are plenty of retail and commercial locations throughout the county that have been ordered closed, and we're going to continue to monitor this situation and make any adjustments as we go forward as necessary.
Okay, thank you, Todd. Next question, Olivia.
So from Kathleen in Delray Beach, our store is going to put a limit on the items in grocery stores. She is trying to do her part to social distance, but has to jump from store to store to find different items.
Todd, I hate to do this to you, but what do you think?
Well, we are urging people to please take some personal responsibility throughout this ordeal. We are asking folks to work with one another, work with their friends, work with their neighbors. If you have individuals that who are staying at home or 65 or older, ask them if you can go out and buy some of those necessities that they need to keep them in place. I know our retailers are doing the best that they can to stock these items. There is a supply and flow that's coming in. But please use your discretion. I mean, there seems like there is still a lot of good stock and flow of goods that people need. But we understand that it does take some time to restock if people are, grabbing too many things off the shelf. So my best advice is for everyone to please exercise some respect for their fellow neighbors and Palm Beach Countyans, and to help their neighbors out when they're going out to get things to cut down on those trips.
We have Sharon LaRue from 211. Sharon, do you want to make a comment on that? Tell everybody what you do.
Yeah, this is Sharon LaRue with the 211 helpline. We are the 24/7 helpline and suicide hotline for the region. So what we encourage people to do is if they're confused about instructions, if they're confused about what information they're being given, to give us a call. We're able to help. We're able to direct you in the right place. And for people who are just feeling stressed or overwhelmed, we're there for you too.
All right. So I guess the answer doesn't sound like there's a very good answer to your question, Kathleen, and I think that it's a common problem. But Todd, I think you had the best advice, which people stop hoarding and help your neighbors. All right, let's go, Olivia.
So our next question is from Marjorie, who is a dental hygienist, and her dentist boss is guaranteeing her job after the virus. But right now she's frustrated because the unemployment application keeps asking her to apply for other jobs. What should she do?
Oh, boy. Thank you for asking that question because, we're getting lots of calls on that. Just to let you know, the Florida their application online is totally outdated for the purposes of the emergency assistance. And I have, just to let you know, Marjorie, myself and some of the other members of Congress, we have written the governor a number of letters. We've been on the line with them, and we've said to them, you got to modernize that form. So what I would do is, no one's going to require you to look for another job. You should know that. Fill out the application as best you can.
Yeah, this is Senator Lori Berman. I have a couple ideas that they can follow through on that
Lori,
also.
go ahead.
Great. Thank you.
Lori.
And thank you so much. Good evening, everyone, and thank you, Congresswoman Frankel, for organizing this call. We all know the reemployment assistant website is really very overloaded, not working well, and it's a big problem. But so what they have told us is that individuals should check the terms and condition box anyway, ignore the Employ Florida registration email, and ignore the job search requirement questions. We got that directly from the head of the Legislative Affairs. So those are the three things when you're filing that you should be aware of. Check the terms and condition box anyway, ignore the Employ Florida registration email, and ignore the job search requirement questions. They have expanded the hours for the reemployment assistance call center, but we know that that's not working very well either. We're all upset about this, and it needs to be fixed immediately, and they're working on it, but it's not working the way it should work. But that's your specific answer on what you should be doing as you're actually filling out the application.
Thank you, and I think it's a misnomer right now to call it the reemployment center. This is not about reemployment. This is about getting people financial security so they can stay safe until it's safe to get back to work. So, Marjorie, thank you for your question. And thank you, Senator Berman. Olivia, next question.
Sure. So just for those of you who are joining us now, as a reminder, you can press *3 on your phone to ask a question or comment. Again, that's *3. Our next question comes from Alan in Boynton Beach, and he wants to know, will seniors on Social Security get cash payments?
Yes, as long as they meet the income requirements. So right now, if you make up to $75,000, you're going to get $1,200 back. And that's the answer. Next question.
Okay, great. So our next question is from Robert in Boynton. He asks, do you think they will ever get a van to come to my 55-plus community to test us all?
Robert, I don't think that's going to happen anytime soon. Todd, does anyone? I know. I'm going to ask Dr. Alonso. You were on the line with us. Dr. Alonso is a director, really a fabulous director of Palm Beach County Health here. Well, you want to take that question?
I'd be glad to. Thank you very much for this opportunity to speak to everyone, and thank you, Lois Frankel, for doing such a great job in getting us all together and being able to ask these questions. The entire system that's being set up will be fixed locations where people can drive to. We recognize that not everybody can drive, and so we're trying to do some alternative sites where you could actually not have to drive in. But the idea of the drive-through is that that's the quickest way to see the most people and get the test done. But the idea of a van coming from place to place is just very inefficient. It's very convenient for where they decide to go, but it's not efficient in terms of getting a lot of people because you waste the whole time driving. So perhaps if someone has a van that you could take people to a site, and most of these places are by appointment only, that you could set that up, certainly would be an option to take the van to the location. So that might be something that folks think about. Thank you.
And I think, Doctor, from what we've been hearing is you really, right now, there's not enough testing equipment available, so that really, unless you are sick, you have some symptoms, you need to stay home. But if you have some symptoms and you think you should be tested, you should call a doctor and make arrangements that way. Is that right?
That is correct. I want to emphasize what I have talked about before, that whether you are positive or negative, the treatment is exactly the same. So in terms of how you're going to treat this, because there's no antivirals and there's no medication for this, the treatment is acetaminophen for the fever and the aches, hydration, and resting in bed. If a person becomes severely ill, where you're having shortness of breath, any kind of chest pain, or you're in a situation where it's an emergency, that would obviously have to make the determination whether you go to the hospital or you call 911. We're begging people not to call 911 just to get the ride to the hospital. They will actually decline that because that's not what 911 is. When you do that, you're taking away the fire rescue from people who are critically ill. So right now the testing sites are, if you're 65 and over and you have symptoms, they will test you. So they're going to ask you that when you call and ask for your appointments. Some of the urgent centers are testing folks, and the requirement for that depends on the testing sites. So if you call, there are some urgent care centers that are testing people and sending it to their labs, and then you have to wait for those results. The conditions for that depends on that testing site, and they're changing often. I believe the most of them are still following the same requirement, over 65 with symptoms.
All right, thank you.
We are yes. Okay.
Okay, Doctor. I think that's a great answer. Olivia, you got another question?
Yep. So Melanie from Boca asked, what correspondence have you had with the governor in regards to a shelter-in-place order? Is there any movement toward a type of statewide action?
Well, I think it was either yesterday or the day before. A number of us, I would say about half of the members of Congress who represent districts in Florida, wrote a letter asking for a statewide shelter in place. Our feeling being that, as I said before earlier in this conversation, is we've said better safe than sorry. We see what's happening around the world and in other states, and it appears that where people are sheltering in place, you have less infections. And what we're worried about right now is that because there's been so little testing in Florida, we're concerned that there may be some misinformation. I don't say misinformation, but people thinking, hey, we don't have to worry. And so we want people to defend themselves, and that is as much as possible to practice the social distancing, stay in place. And we think that we can avoid what's happening in New York and Washington State and now in Louisiana if we could put those precautions in place now. Unfortunately, the governor has resisted that, and we'll just wait and see. Thanks for the question.
This is Dr. Schillinger. I would reiterate what Lois just said, how critically important it is for people to do the social distancing, et cetera. The testing alone is not really going to give you a total sense of security either. This will help to identify people who are infected so we can be 100% sure that they're not going out. But just because you might test negative today, you could test positive tomorrow. So that is not going to be giving you an excuse to ignore the whole social distancing.
Thank you, Doctor. Thank you. Good advice. Olivia.
Thank you, Congresswoman. And just as a reminder, you can press *3 now to ask a question to the Congresswoman and our guest experts. Our next question is from Nancy in Boca. Nancy asks, I am a caregiver for my father who has Alzheimer's. Will I be eligible for the stimulus?
Thanks. That's a good question. Everybody in America is eligible. I'd have to ask you back a question. I know you can't talk to me, so I think it is how much you would be eligible for will depend upon what your income has been. So I'll tell you what we can do. Why don't we get we'll follow up with you and try to see if we can answer your question specifically. But for most people, the answer is yes, they will get, anyone who's making up to $75,000 a year will get a check back from the federal government, probably in about 3 weeks. Olivia?
Our next question is from Denise in Wellington. Denise wants to know, how do we encourage kids and teens to stay home when they aren't taking the advisories seriously?
Well, I think this is a good question for Karen Rill, a member of our school board.
Thank you, Congresswoman Frankel. So, first of all, we are going to be we're launching our virtual learning on Tuesday. Monday's actually a holiday still for the children, and the students are going to be expected to complete their coursework. So we need our parents to be vigilant in making sure that our children do their coursework. It's a little difficult with teenagers. It's not only a school issue, it's also our homeowners associations. Yesterday, I saw a group playing basketball, so we had to take the basketball hoops down. But we need to make teenagers know that they are also being affected by this illness, and the safest thing they can do is to go online, to do their work, to use social media to communicate with each other, and they can also create meetings with each other online. So that would be my best suggestion, is to just continue to do your coursework, because it's going to be expected in order for you to proceed to the next grade level.
Oh, this is a time for creativity. Olivia, next question.
Thanks, Congresswoman. The next question is from Barry, and he wants to know, what does the stimulus have for self-employed people?
Well, thank you. We have just to let everybody know, we have Althea Harris from the Small Business Administration with us. So I don't know whether, Althea, would you like to answer that question? Well, I guess I don't hear her. So I'll answer the question.
Hello?
You will be, I'm sorry, Althea. Yes.
Oh, can you hear me? Wonderful.
Yes, I can. Yeah.
Wonderful.
So
Thank you so much.
Okay. Did you hear the question, Althea?
I did. What does the stimulus have for self-employed people? I'm going to add / small businesses.
Okay. Well, let me answer I'm going to let you answer the small business question, but I want to add this. You will be treated like anybody else who has lost their employment. So you will be eligible for unemployment. It's $600. The federal emergency package it'll be $600 a week for 12 weeks. No, I'm sorry, for 4 months. That'd be 16 weeks. That is in our initial package. And so you will have to go through the application process that everybody was just talking about before. It's a little messy right now, but you will be able to file through Florida Unemployment or Florida whatever they're calling it now. Hopefully they're going to change the web page, but you'll be able to file through Florida for that. In terms of small business, I'm going to turn it over to Althea Harris.
Thank you so much. I think you have the best person on the line to answer what's involved in the stimulus. What I can tell you is that right now, the SBA's Economic Injury Disaster Loan Program is in full swing. We are accepting applications at our website, www.sba.gov/disaster. There you can make your application. We are offering direct loans to business owners up to $2 million, as well as private nonprofits up to $2 million. And it can be for a term as long as 30 years. The interest rate for business owners is 3.75%, and for private nonprofits, 2.75%. So we are urging all business owners who need to cash flow in this time period to be able to meet their expenses that they would have ordinarily been able to meet had not this virus impacted us all so adversely. They can apply to the SBA to receive a direct loan from the federal government to help them meet those expenses.
And just to add, the loan is a forgivable loan. So we'll be happy to work with the caller after this call, we'll follow up with you. But just to know that you can, I think it's called Florida. It's called reemployment. Again, you don't have to be looking for employment, but you're just going to have to deal with the current application process that Florida has right now. Okay, next question.
Okay, thank you, Congresswoman. Our next question is from Angela in Boynton. She wants to know, are they going to do tests for everyone even if they aren't showing symptoms? She's getting mixed signals, but she is over 65 and has heart conditions.
Well, I would say that point, probably. Go ahead, Dr. Alonso, go ahead.
At this point, it's only over 65 with symptoms. As tests become more available, remember, this is not ending anytime soon, folks. This is going to take many months. This is going to continue. This will go. It will go to the southern hemisphere when the summer comes, and then it will come back next winter, as the flu does. So this is not going away. So as more tests become available, there will obviously be more availability for those tests to be done. They're even doing some rapid tests now that have not been approved by the FDA that are done in 15 minutes with a finger stick. Those have not been approved, so don't let anybody charge you for those because they're not approved by the FDA.
All right, thank you very much. Next question.
Great. Our next question is from Freya in Boynton. She wants to know, do I need a prescription from my doctor to get tested?
Dr. Alonso?
The answer is yes. If you take it to like Quest or LabCorp, you're going to require a prescription. The drive-thrus are not requiring the prescription.
Okay. Thank you. And next question.
Thanks, Congresswoman. Our next question is from Karen in Wellington. Karen wants to know, how do I know if my house is clean enough to not touch my face? Does the virus stay in the air? Does it float? Can it be transmitted by stepping in it?
So I'm going to let our two doctors, Dr. Schillinger and Dr. Alonso, who would like to take that question?
Okay, well, I'll step in on this one.
Go ahead.
Okay.
Okay, the question was, how do you know if your house is totally clean? Well, we're never going to know 100%, but from what we understand, the virus could potentially live off the body in the droplets, if there are droplets that have been deposited in various areas. People have done different studies suggesting it may last longer on metal or on wood or plastic, although for the most part, it's probably not going to live very long off the body. But to take a precaution, you want to make sure that you've cleaned off all the surfaces. And one thing that we do know is the virus is very, very sensitive to cleaning agents. And if it's on your hands, soap and water, 20 seconds of washing with soap and water will pretty much kill it. On the surfaces, use any type of cleaning agent, particularly some of these bleach agents, that will pretty well kill it. So it's not a very viable virus once you clean the surfaces off.
Now, so she also asked, "What can you step in it?" Or I think that was one of the questions. Can it be transmitted by stepping in it?
It does not go through your skin, and it will not go through your shoes. You have to literally put it in your eyes, nose, and throat in order for it to enter and then go down into your lungs. So it's rather difficult to actually catch it. I agree with the issues of the different timing. I'm not counting on knowing whether or not the virus is dead. I simply wash my hands and do not put my hands to my face. That way it's not going inside of me, irrelevant of what I'm touching or not touching.
Okay, so she also said, does the virus float in the air?
These are air droplets which fall. In order for it to float in the air, you would have had to sneeze up into the air, and then they would fall down. The other way that something could be aerolized into the air is if you're having a procedure in the hospital, which then that could occur. So the normal way you're going to get it is somebody sneezing or coughing, and then those droplets will fall down, not up.
Okay, so
and the limit is probably something It's probably something like 6 feet, which is why we have the 6-foot rule. So if you were in public and you saw somebody sneezing, if you're more than 6 feet away from them, you're probably pretty safe.
Okay, so when you get your groceries home, wipe it off with a Clorox wipe or something, and then is that what you're supposed to do?
And wash your hands.
Wash my hands. Yeah, and wash your hands. It's not about cleaning the thing.
Yeah, wash your hands and don't be touching your mouth and your nose.
Okay, got it. Okay, thank you. Next question.
Thanks, Congresswoman. Our next question is from Joel. He wants to know, I have 2 jobs. My part-time job had to stop, but my other job didn't. I'm struggling to make ends meet. Can I apply for unemployment?
That's a good question. I think the answer is yes, Joel, but we're gonna get back to you on that. Just to let you know, this legislation is coming fresh off the presses, and we don't know exactly the answer to all these questions. Does anybody else know the answer?
Yes, Congresswoman, it's Senator Berman again. Under the way the misnamed reemployment insurance that works in Florida, if your hours are lessened, you can still apply for the unemployment insurance. So even though you have another job, if your hours are lessened, you are still allowed to apply for reemployment insurance.
Thank you, Lori Berman, for the save there. Thank you very much.
Sure.
Okay. That's good. Next question.
All right, just a reminder that you can press *3 to ask a question now. And as another reminder, if you would like us to follow up on your question or if your question is not answered, you can leave a voicemail with your contact information at the end of the call and our office will get back to you. Our next question is from Solomon in Delray. Solomon says, I am 92 and live alone. I don't have anyone to buy groceries for me. What do I do?
Oh, I'm so sorry, Solomon. I think when we get off this call, we're going to try to get you some help. But I'm going to let why don't I let the Sharon LaRue? Can you answer that question?
I would be happy to, and I'm so sorry to hear that, Solomon. But I want you to remember the 211 number, because you just have to dial that number and somebody is there and you can tell them what's going on and they can talk to you. In fact, we also have some elder advocates, and they can actually, if necessary, and you haven't had food in your house, they can actually drop off some food for you. So give us a call and we will see what we can do for you. All the best.
Does anyone else want to?
About you.
Thank you. Anybody else want to respond to that? Solomon, this is Lois Frankel again. There are delivery services, and we're going to also kind of try to hook you up with some folks who maybe can help you. So we'll take your information and get hold of you. And actually, I mean, the sad thing is, Solomon, I think you're probably an example of many, many people who are in your situation. And I think we're going to have to work with our county folks to try to make sure that nobody is left alone without food or getting the health care that they need. Thanks for asking that question. Olivia?
Okay, our next question is from Teresa. She asks, I tried to apply for unemployment, but I couldn't figure it out. Where do I go for assistance with my application?
Senator Berman, I'm
back.
To you.
There is a phone. There are phone numbers at there's an assistance call center. I don't have the exact phone number here right now, but we will get that and make sure it is on the Congresswoman's website. If the website isn't working functionally, which we've heard that from many people, you're probably going to have to get in touch with somebody and work with them on the phone, and we will get that website number for you. They do have longer hours. They are not open now from Monday to Friday from 7:30 to 6:30, and Saturday and Sunday from 8 to 2. And we've heard stories that it's really hard to get through, but that seems to be, if you're having trouble with the website, that's probably going to be your only avenue at this point.
So just to repeat what we said before, I know people are getting on and off these calls. This is a very good question, Teresa, because I'll say thousands and thousands of people having this problem right now in Florida. The system's overwhelmed, and the application form is antiquated. Keep trying. Lori, you may want to repeat the fact that they should just ignore. Tell them the three things that they should ignore.
Absolutely. So just for everybody's information, on March 7th there were 5,000 claims, and on March 24th there were more than 31,000 claims. So the website is very overwhelmed. So a couple different things. One is they've told us the website's not even set up correctly because the governor has waived many of the requirements. So when you fill out the application, you should check the terms and condition boxes anyway, even though you know that you don't have to work. You should ignore the Employee Florida registration email, and you should ignore the job search requirement questions. And I did get that phone number since we were talking, and the phone number for the Reemployment Assistance Call Center is 1-800-204-2418. Just keep trying to call and get through to somebody, and hopefully they will be able to help you. It is terrible that the system is functioning the way it is, but they are overwhelmed, and we've got to get, the state really needs to get to work and get that system functioning, because we know that people's livelihoods are dependent on it. People don't have any money, and we need to make sure that people have money so that they can buy food and have roofs over their head. Thank you.
And just, Teresa, to let you know that my office and Senator Berman's office and others, we are pleading with the governor to try to get this web page working. Thank you for that question. And next, Olivia.
Thanks, Congresswoman. Our next question is from Diana in West Palm Beach. Diana asks, if there is a stay-in-place order, will I still be able to care for my mother who lives somewhere else?
I'm going to have Todd. Will you try to answer that question?
Sure, Congresswoman. So, obviously different orders come with different meanings to it, and the details in them differ depending on what they are. In some areas where we've seen stay-at-home orders, they allow individuals to travel outside of the home for food, for emergencies, for work. So there are some exceptions that are in there that allow you to move to take care of some of those, necessities that you have. And obviously, if you have a loved one that is relying on you for their care, then, those could be emergency situations that you need to travel in to make sure that happens. But I would say that depending on what the situation is and what those orders look like, you just need to look at some of the details, and I think Dr. Alonso is going to add some other information as well.
One of the things that we've done during hurricane seasons and other emergency that we've had is that your physician can write you a note saying that you are a caregiver for your mother living at 200 Arlington Road, and that allows you to travel to and from that home. So the sheriff and the police are very cognizant of the fact that people will be moving around. Even in California, people were not locked into their homes, unable to leave. So all those things are taken into account.
Thank you very much. Next question, Olivia.
Thanks, Congresswoman. Our next question is from Teresa in Wellington. She asks, I have been quarantined for 10 days and have no symptoms. How much longer do I have to stay inside?
Well, the official recommendation, 4 more days.
Okay, so the quarantine, she didn't exactly, I guess she was quarantined rather than self-sheltering. I mean, many of us are staying in place and just to avoid getting the virus. I'm assuming that the question is she was quarantined because she thought she had been exposed. So, Dr. Alonso or Dr. Schillinger, why don't you just answer that quickly?
Yes, this is Dr. Alonso. Thank you. The quarantine means that somebody has told you to stay home because they suspect that you may have come in contact with somebody or something of that sort, right? So they tell you 14 days. That's how many days you need to stay in your home, 14 days. The reason it's 14 days, because, yes, it's true that we say that usually you see symptoms in the first 5 to 6 days, but it's a virus, and so we're taking an average of the shortest and the longest time. So 14 days is the time that you're safe. You've got to stay there for the 14 days. That's what we recommend.
Okay, thank you for that. Olivia?
Thanks, Congresswoman. Our next question is from Anna in Boynton, and she is a school district employee. She wants to know, are there any updates on when schools will reopen?
Karen Brill, school board member, would you answer that question?
So at this time, there are no updates. As people may recall, we officially closed our schools until March 30th, and then the governor closed it further to April 15th. Rumor is the governor would like to reopen schools on April 17th. That doesn't mean that we will. But at this point in time, just keep checking our website, www.palmbeachschools.org, for any updates.
Thank you, Karen. Next question. Olivia?
Okay, our next question is from Sandy, and she wants to know exactly how much PPE does the county have? And I think it would be helpful to explain what PPE is as well.
All right, we'll send that over to Todd from the county.
And I think I'm going to have, and Dr. Alonso will start off here.
Okay, that's good. Okay, Dr. Alonso.
The initials PPE mean personal protective equipment. We refer to masks, gloves, gowns, and goggles as the usual personal protection that people in the health field, fire rescue, the sheriff's department, police utilize when they come in contact with someone who we feel may have an illness or anything to protect them from getting infected. Because it includes so many things, each hospital and each fire rescue unit is keeping a very close track of all those things, but I cannot possibly give you a number of how much we have. We need more PPE because we're using it much faster than we usually do because we have to suspect that everyone that we come in contact with at this point, just as you should suspect that everyone is infected. We have a lot more people in Palm Beach County who are positive and don't even know they have it. So you have to assume that, and so that's why it's being used up so quickly.
And I can tell you,
okay,
from the physicians out in the field perspective, we definitely are feeling the shortage. And one of the things that we're doing, which is kind of unprecedented, is to reuse things such as the respirator masks. Many of those things would be disposed of after each patient, but because of the shortage, we're forced sometimes to use something for an entire day.
So I think, we're not going to get into the politics of this, but just to say that there's been some misinformation if you're watching television in terms of supplies and so forth. I can tell you that there is a shortage of these personal protective equipment all over the country. I've been on conference calls with my colleagues from Congress. We have been on conference calls constantly for 10 days, and I can tell you this is a complaint of everyone. I was on a conference call today with FEMA and with the emergency management folks of the state of Florida. They have told us they're going to be sending more of this equipment down to the counties, but from what I can tell, from what they've said, it's going to be slowly but surely because there is a lot of demand. But we're going to keep pressing. Okay, Olivia, next question.
This is Dr. Schilling. Real quick one on that. We in the medical field hope that gets here sooner rather than later, particularly with the anticipated surge in very ill cases in the hospital. We've seen the examples, particularly on the West Coast, out in California and Washington, where some of the hospitals have limited care to the sickest people because there's not enough protective equipment to go around for the staff. So hopefully it gets here before we face that dilemma.
Thank you. Next question.
Thanks, Congresswoman. The next question is from a primary care physician in Wellington, and he asks, He's been hearing that testing sites are coming, but he is getting frustrated with the lack of answers for his patients. Can you tell us what the timeline looks like?
I'm going to send that over to the county and Dr. Alonso.
Yeah, so thank you very much for that question, and we have been very frustrated in trying to do more to get a testing site in Palm Beach County. We're working closely with the state. We're asking FEMA to engage and to provide a site here similar to what they've done in Dade and Broward counties, and we are working with our local partners as well to do more to try to stand up, some local staging sites as well. And I know that Dr. Alonso and her team have been working very closely with ours, and I'll ask her to share a little bit more on that as well.
Right. Ideally, we would have that FEMA team. That's the ideal situation. They know how to do this. They have very good equipment and so forth. We're kind of being slighted because they think of us as a region. In other words, the Keys, Dade, Broward, and Palm Beach is a region. We're called Region 7. And so they feel that they have put a FEMA site in our region. Obviously, it is not practical or even safe to be driving all the way to Fort Lauderdale, especially with the population that should be going there to be tested. So we're fighting for it up here. All of our representatives are asking the governor to and the feds to give us a site. We will continue that. In the meantime, we're trying to come up with some local solutions like we usually do in Palm Beach County, and we hope to have that soon, but I cannot give you a date. I'm sorry.
We were
Dr.
promised
Schillinger,
on a...
to echo,
go ahead, Doctor.
Yeah, to echo what Dr. Alonso said in the beginning of the program tonight, while testing is important and is an important tool in determining who is infectious and where the cases are going, it's not going to in any way determine the treatment. So a word to my physician colleagues is you need to help relieve the anxiety in your patients and say when testing is available, we'll have it, but it's not going to make any difference in terms of your prognosis or the treatment at this point.
Thank you very much. Next question, Olivia.
Our next question is from Leslie in Lake Worth. She wants to know, what do people without health insurance do if they get sick?
Dr. Alonso.
Yes, we're very fortunate in Palm Beach County that we have 3 federally qualified health centers, and we also have 2 volunteer centers, one in down in Boynton and another one up in Jupiter that are free clinics, and another one in West Palm Beach, as a matter of fact. So the 3 federally qualified health centers are Genesis in Boynton, Found Care in Palm Springs, and the healthcare district has multiple clinics. They have closed some of their clinics because they are mostly doing telemedicine at this point. They're calling their patients. They're only doing necessary visits, and most of the patients that they're dealing with are on the phone. They have dedicated physicians that are calling patients and taking care of them via the phone. They have a telephone number to call. I don't have it to give it to you, but look up C.L. Brombach Clinics. Those are the federally qualified centers for the healthcare district.
And Congresswoman, one thing that I would just emphasize that Dr. Alonso said, and in this unfortunate incident, it's starting to adjust our behaviors, and the issue of telemedicine is one that I think is very important to this discussion, and we've been pushing more and more people to do that. Our local providers in the community have really stepped up. The Baptist Health, the tenants, the Cignas and others who have been pushing a lot of their platforms are all ones that I think are really kind of stepping up to try to do their part to keep people at home, but provide more opportunities on the health side. And so hopefully people like Solomon who are at home and not able to get food and some of those other services can look to more of these types of services to try to help him and others on the call that might need them.
And for those of you who don't know what that means that you can either through your smartphone actually talk and speak to your doctor. Your doctor can actually visualize a lesion or take a look at how you look, listen to you, have you check either your blood pressure or different things, even through the telephone. There are apps now that can actually do those things. So the need to actually go into the clinic has been reduced, and now with this emergency, they have waived some of the conditions so that we can go ahead and do that without any violations or any other problems. So it's helped us a lot to be able to actually answer your calls, take what you need over the phone, write you a prescription, send it to the pharmacy, and you can pick it up. And at our clinics, for example, we're actually taking the prescription out to your car, so you don't even have to come into the clinic.
And this is Dr. Schilling. Just wanted to mention Palm Beach County Medical Society has set up a special COVID-19 Physician Resource Center to educate and advocate for our patients and our physicians, and high on the list is a resource for telemedicine, so we can get all the physicians in the county part of that process.
That's great. And just to let you know, we passed a new law that will allow Medicare to pay for the telecommunicating visits. All right.
And I'll say one other thing on telemedicine, one real quick thing. It's for a lot of the senior citizens, it's difficult to figure out how to get through the computer and how to do all the requirements. And there was a request that went out yesterday from the American Medical Association to the federal government to waive a lot of those requirements so that people could just talk on their phones to the physicians. And I think that will be approved momentarily.
Okay, thank you very much. All right, Olivia, next question.
We
have a few more to go, folks.
Yep, our next question is from Carrie in Boynton Beach. They want to know, why is it okay to get takeout from restaurants?
Okay, who can, well, I think that's a doctor question.
What's the doctor question in the sense?
Is it okay to get a takeout from a restaurant?
Yes, it is. As a matter of fact, that's why the restaurants have been allowed to continue doing that. The idea of closing the restaurants is so that people aren't sitting next to each other and that. But to take out, it's perfectly fine. And they will. Some places are actually taking it out to the curbside, so you don't even have to get out.
Excellent. Next question.
Thanks, Congresswoman. Our next question is from Alan in Lake Worth. He wants to know, how do small businesses process paid sick leave? If a business gets a small business loan and brings employees back, will the loan be forgiven?
Let's see. Does our small business person want to answer that question? Or you?
Can you hear me?
That's it. Althea Harris?
Yeah, can you hear me?
Yes, we can.
Can you hear me?
We can hear you.
Oh, okay. Oh, fantastic. Okay, so the question was, how do they process? I didn't hear the front part of the question.
First question is, how do they process? Okay, go ahead, Olivia.
Sure. So how do small businesses process paid sick leave? If a business gets a small business loan and brings employees back, will the loan be forgiven?
Oh, okay. So your question centers around what's in the stimulus bill, and I think I would prefer to defer to the Congresswoman about what exactly is in the bill, but I have heard from different reports that monies used by small businesses to meet payroll demands and keep their employees on the payroll, those monies might be converted later into a grant. But Congresswoman, I defer to you on that.
Yes, that would be the correct answer. The loan will be forgiven for payroll use and other uses. There's specific. You'll be able to go online and see all the details of that. But yes, generally that is a correct answer. In terms of paid sick leave and so forth, where you're going to get a credit for allowing someone to use family leave or paid sick leave, and that you should also, when you need to know the details of that, because only certain people are eligible, but that money you'll be getting a tax credit, and that you'll be getting through your income tax, and that's something you work out with your accountant.
Congresswoman,
but I'd also, if I may,
yeah,
if I may just add, in the meantime, SBA's Economic Injury Disaster Loan Program is
in place, and you can apply for it to make payroll payments if that's what you desire to do. So our program is up and running. It's at www.sba.gov/disasters, where you can apply for up to $2 million for small businesses for a term of up to 30 years at 3.75% simple interest.
That is not a grant, right? That's what's called a bridge loan.
That's correct.
That loan will not be forgiven. The new
That's correct.
bill. That's correct. The new law that came out of the federal government through the SBA, you're going to be able to get basically free loans if you meet certain conditions. Lori, did you want to say something?
Yes, I did.
Okay.
Thank you, Congresswoman. There is also a loan that the state of Florida has recently initiated. It's called the Florida Small Business Emergency Bridge Loan. These are short-term, up to 1 year, zero interest rate loans of up to $50,000. It isn't a grant. It is a loan program, and you probably will have to pay it back, but it's zero interest for $50,000. The business has to be for-profit, privately held, and have a minimum of 2 but no more than 100 employees. So that's another option for people that are available to help bridge some of the emergency money that you need to keep your business afloat.
Okay, thank you both. Next question.
Thank you. So we're coming towards the end of our call now. So one of our final questions is from Marianne in Lake Worth. She wants to know, according to Governor DeSantis, over 190 flights came in on Monday from hotspots like New York. Are these people being screened? Do our resources go to them?
That's a county health issue. Yep. Dr. Alonso, Todd?
Yep, and we are working very closely with a number of different agencies with our airport in Palm Beach right now, and there's a process that's been set up. And Dr. Alonso has been instrumental in helping us out with that.
The process involves the National Guard and the Medical Quality Assurance Division, which is a part of the Department of Health. It is not part of the local health department. As a matter of fact, I was on the phone with them last night when they were setting it up, and they started this morning. It is not the screening that you think of. What it is the folks are being told that they need to stay home for 14 days to look for symptoms, that they need to stay in their homes and look for symptoms. So it's not that we're setting up a clinic or anything in the airports.
All right. Well, I think we're going to get to our last question now. And I want to just, first of all, before we get to our last question, I want to thank everyone. I think this has been a great discussion tonight. All our participants, you have been terrific. State Senator Lori Berman, you really have been a saver tonight. Dr. Alina Alonso, Director of Palm Beach County Health Department, thank you. Todd Von Laren, and I know Virginia Baker's there somehow in the background there. Dr. Brent Schillinger, Althea Harris, and Sharon LaRue. Thank you, Karen Brill, and thank you all for being with us tonight. And let's take our last question.
Thank you, Congresswoman. And as a reminder, if you still have a question to ask or your question wasn't answered and you would like to be contacted by the Congresswoman's office, please wait till the end of the call to leave a voicemail with callback information. For our final question, it is from Gail in Delray. She asks, she's healthy and wants to know if it is okay for her to keep walking outside.
Well, I think that's an easy one. Dr. Alonso, why don't you give her the good news?
Oh, yes, I am there. Thank you. Great question. Thank you for letting me have the last one. Of course, we want you to exercise and continue walking or jogging. What we would ask you to do is that you maintain the 6 foot or more distance. I have seen lots of people actually doing this along our neighborhoods. I've even seen people walking down the sidewalk, running down the sidewalks or walking and then moving over to the side of the road so that the other person can go by. So I think you guys are setting a great example that you're doing something really healthy and at the same time maintaining the social distancing. So thank you.
So again, thank you. I think that we can end with that great advice. Everybody remember, you yourself are the best defense against this pandemic. Keep yourself socially distanced as much as you can. Wash those hands and don't touch your face. And go to our website at frankel.house.gov to get a lot of this information you heard tonight. We thank everybody, and everybody stay safe. And good night.
Thank you so much.
Thank you.